In the fifth and final section of our lecture, laser surgery, we will talk now about some safety precautions in the use of laser therapy. What are different precautions we should take before the use of laser and the photodynamic therapy? Safety precautions in the use of laser therapy. Very important is the education of the staff. The staff should be properly educated. People who are handling the lasers, they should be educated. So they should take proper precautions for their own safety and for the safety of the patients. So education of the staff is one very important safety precaution. Then protection of the eyes and skin, endotracheal tube protection, anesthetic gases. We will talk about these steps one by one, what type of gases should be used and how we can perform the safety precautions when handling these things. Evacuation of smoke, and then tube fires. Always display a sign outside the operation theater that says lasers in use and laser on. So when the lasers are in use in the operation theater, it's very important that there should be a sign mentioning the laser is on. So anybody who is entering that room should be very, very careful, cautious, or they should not enter at all unless the radiation is or the laser therapy is stopped. So display a sign that laser is on. Close the OT door. No entry or exit of the staff is permitted while the laser is on. Protective glasses specific for the wavelength of lasers. It's again very, very important that if the glasses are not effective against the wavelength of the laser that is being used, then there is no point of wearing those glasses. They are not protective enough. So we should use the glasses that are protective against the wavelength that is being used. Also, glasses should have side protectors also. So front protection of the glasses is good enough, but the side protection should be there also. Carbon dioxide laser, plain clear glasses, optics for microscope are also protective. Argon or KTP laser, amber color or orange yellow glasses, ND-YAG blue-green glasses. So these are all the different type of protective glasses that can be used against different lasers. Wet saline pads are placed on the eyes, and saline soaked towels for face or exposed part of the skin. Use wavelength specific endotracheal tube or wrap the tube with aluminium foil. So if the endotracheal tube is there, we should use the endotracheal tube that is specific for that wavelength which is being used, or we should wrap the tube by the aluminium foil. Use methylene blue color saline for cuff of endotracheal tube. So all these are protective or safety precautions we should follow when we are using the laser beam. For invisible laser beams, specially use non-inflammable gases such as enfluorine. So during the procedure or when we are using the gases, we should use non-inflammable gases such as enfluorine. Oxygen concentration in inhaled gases should not exceed 40%. Do not use N2O. Keep a bowl and a syringe filled with saline in readiness in case of the fire of the tube. Special precaution is for the invisible laser beam. So all these precautions are very, very important, and we should follow these precautions, because as I mentioned in the previous section, one of them, some of these laser beams, they are also carcinogenic, and they cause destruction and can be the cause of the cancer. So precautions, safety precautions should be very strictly followed, especially in the use of the glasses and the side shield of the glasses. Next, photodynamic therapy. Principle is of photodynamic therapy is injecting a photosensitizing agent taken up by the tumor cells, exposing the site to specific wavelength of laser. Laser activate the photosensitizing agent and cause destruction of cancer cells. So photodynamic therapy, the principle of this is a dye is injected, which is a photosensitizing agent. So photosensitizing agent taken up by the cancer cell, when the beam is inserted on that, that is taken up by that photosensitizing agent present in the cancer cell, and this causes destruction of the cancer cell. Next, the use of photodynamic therapy. It is used for treating cancers, as I mentioned already, by injecting photosensitizing agent that is taken up by the cancer cell, and when the specific wavelength laser is applied or beam is given, that is taken up by the cancer cell and cause destruction of the cancer cell. So it's very effective for treating the cancer, skin cancer, laryngeal cancer, nasopharynx, and it's used for tumors of aerodigestive tract, endobronchial tumors. Recurrence after surgery is treated by photodynamic therapy and radiation or chemotherapy. Argon tunable dye laser with a wavelength of 630 nanometer. Advantage of delivery through flexible fibers. Avoid exposure to sunlight and use sun protective clothing. Photosensitizing agents which are used, we have intravenous hematoporphyrin derivative for head and neck cancers, photosan 3 for endobronchial tumors. So these are different sensitizing agents we can use. These are the one given in the veins. Then we have topical, which are applied on the skin. They are delta aminolevulinic acid for skin cancers because they are topically applied, basal cell carcinoma and Bowen disease. So that concludes our lecture, laser surgery, in which we talked in detail about different aspects of the laser surgery. What are the different lasers we use? What are the different wavelengths of the lasers used? And what are their advantages and disadvantages? Thank you for watching sqadia.com.